Dear students, welcome back. In this session, we are going to start a new region called abdomen. In the previous sessions, we have finished the thoracic region. Now, in the abdomen, first you should know what do you mean by abdomen, from where to where this abdomen is extended and its divisions, and what are the contents present inside the abdomen, how it is divided into different kinds, and what is the cavity present inside the abdomen. And after that we are going to see the osteology of the lumbar region, and then the soft parts, and then the organs. Now, if you see, this is the human body. So the upper part of the human body is called as trunk, and this trunk is divided into thorax, upper part thorax, and the lower part, this one is abdomen. And the trunk is divided into upper part into thorax and the lower as abdomen by a muscle called diaphragm. So the diaphragm divides the trunk into upper thorax and lower abdomen. Okay, and if you can see here, this is the lateral aspect of the entire abdomen, and this one is the coronal part of the abdomen. And here this abdomen is divided into upper larger part. So here if you can consider here in this pic, so this is the upper larger part of the abdomen, this is upper larger part of the abdomen, and this one is the lower part of the abdomen. Okay, here you can see on the lateral aspect, this one is the upper abdominal part and the lower pelvic part. Okay, so by the plane of pelvic inlet, this is called plane of pelvic inlet. Here you can see this plane of pelvic inlet. So it is an imaginary line drawn from the sacral promontory and the superior part of the pubic symphysis, and which makes an angle of 55 degrees with the horizontal plane. So this is called pelvic inlet. This pelvic inlet divides, this plane of pelvic inlet divides the abdomen into larger upper part and lower lesser part. This smaller lower part is called as true or lesser pelvis. True pelvis or lesser pelvis. Okay, and the upper part is called as abdomen proper. What you call? So this upper part is called as abdomen proper, and the cavity inside these upper part and lower part is called as, the upper larger part is having a cavity called as abdominal cavity, whereas the cavity present in the pelvis is called as pelvic cavity. Okay, so this is about the divisions of the abdomen. If you see, so this one is the pelvic bones. So these bones are the pelvic bones, and this pelvic bones, here it is divided into false pelvis and true pelvis. So the true pelvis is this part, and the above part, so here the true pelvis falls here, that we can clearly studied in the pelvis separately. So the above part of this one is called as false pelvis. This false pelvis falls in the abdomen proper only. Okay, now this one is the true pelvis. Okay, the smaller lower part is called as true or a lesser pelvis, and this lesser pelvis, this true pelvis or the smaller lower part is divided into two things. One is the true pelvis, and here you will have some other part here. So that one is called as perineum. What you call? Perineum. So below this part, up to here you will have this true pelvis, and below you will have the perineum part. Okay. So finally the abdomen is the lower part of the trunk, and this lower part of the trunk is divided into upper larger part and lower smaller part by the plane of pelvic inlet, and the upper part of the abdomen is called as abdomen proper, and the lower part of the abdomen, that is the smaller part, is called as true pelvis, and it is also containing another part called as perineum. So the lower part consists of true pelvis and then perineum, but in the abdomen proper, it is having only the abdomen proper. Okay, now we can see the entire abdomen is bounded by large extent. So if you see here, the abdomen is bounded by large extent by the muscles. So it is having only a minimum of bones, that is, it contains only the lumbar vertebrae. If you can see, this is the lumbar vertebrae and coccyx, sacrum and coccyx, and the pelvic bones. These are the only bony parts which are found around this abdomen, and this entire abdomen is bounded to a large extent by muscles, which can easily adjust themselves to periodic changes in the capacity of the abdominal cavity. Okay, that means they can distend or they may thin out or they may bulge out like this. For that, so many movements are there. So for all those changes, this abdomen can easily adapt for all those changes. Okay, for example, they can thin out to accommodate distensions of the abdomen imposed by flatus or gas, or fat which is present around the abdomen, fetus. So during pregnancy, the abdomen is distended, and some of the fluid, accumulation of the fluid. So in all these cases, the abdomen can thin out. Okay, so this is about the divisions of the abdomen. Now we will see, so what are the contents present in the abdomen proper, okay, and what are the contents present in the smaller part, which includes true pelvis and the perineum. Now first we are going to see what are the parts which are present in the abdomen proper. Okay, now so here this part is called as abdomen proper. Okay, this is the abdomen. Up to here only, this is abdomen proper, and this one falls down in the pelvis, lower part. Okay, so what are the contents present inside this abdomen proper? Okay, so the abdomen contains the greater parts of the digestive system and the urinogenital systems. Okay, so what are the parts which are present in the abdomen proper. Normally this abdomen proper is also called as upper part of abdominal cavity. Okay, the contents are structures which are surrounding this organs called as peritoneum, and parts of the gastrointestinal tract, that is stomach, small intestine, okay, and then stomach, duodenum, small intestine. The small intestine consists of duodenum, jejunum and ileum, okay, and most part of the large intestine, which includes the ascending colon, cecum, ascending colon, transverse colon and the descending colon and the sigmoid colon. And it also includes liver and the pancreas. Here you can see the pancreas here. So normally it is present behind, posterior to this, most of the part of the pancreas is present posterior to the stomach, okay. And then urinogenital system includes the kidneys. Here you can see the kidneys. So this one also present at the posterior or lateral aspects of this organs, which are seen on the anterior side. The kidneys and the parts of ureters. So this one is the ureters. So these are the major contents present in the abdomen proper. Okay, and coming to the vessels. So the vessels which includes the abdominal aorta. Here you can see this abdominal aorta. And then the common iliac artery. So this one is the common iliac artery. And external iliac and internal iliac. So here you can see the external and the internal iliac arteries. So here you can see well. So this is the external and internal iliac arteries. And inferior vena cava. Here you can see this inferior vena cava. So here this one is the inferior vena cava and the portal vein, and also major lymph nodes. So here you can see number of lymph nodes which are present here. And addition to all these things, it also consists of suprarenal glands. So that suprarenal glands, here you can see the suprarenal glands and numerous lymph nodes, and also the nerves which are related to the abdomen. So these are all the structures which are present in abdomen proper. Okay, and below this you will have this true pelvis. Here you will have the true pelvis. It is the bony pelvis and the lower portion of the trunk of the body forming a basin. You can see it forms a basin which are bounded anteriorly and laterally by the hip bones and posteriorly by the sacrum and the coccyx. So normally this true pelvis consists of pelvic inlet, and this pelvic inlet we have seen before like this. The pelvic inlet is found like this, which is a short curved canal and which is deeper posterior than the anterior wall. Okay, and it contains the structures which are present in the true pelvis are the pelvic colon, rectum, bladder. So here you can see the bladder here. In the previous session, previous pic, you can find out this rectum and some of the reproductive organs. This largest sum of the reproductive organs. Okay, and this is the true pelvis part of the smaller lower part. Okay, these are all the structures which are found in abdomen proper, and one of the smaller lower part, that is the true pelvis or lesser pelvis. Okay, so and the organs which are arranged in such a way inside the abdomen proper is very complex. Okay, and to understand and to study these structures, where these structures are exactly present, is by dividing this abdominal cavity into number of regions like this. So the entire abdominal cavity is divided into 9 regions to study where the organs are exactly located. And by knowing this, so if you can see here any one of this umbilical region, so this umbilical region is here. This umbilical region includes the parts of umbilicus and parts of the small intestine and the duodenum. That means, so if any physician are going to examine this part, that means the physician is going to examining the parts of the small intestine and the duodenum like that. So they are going to diagnose. So if somebody is having some pain, so here the referred pain is also coming here. So if you have, that is an exceptional case. If some people is having an appendicitis, normally the pain is present around the umbilicus. So that is a referred pain. Referred pain means the exact pain is at exact injury or damage is at one part, but the pain is exhibiting in another part. So that is a different kind. So because of this region, so we can easily identify where the parts of the abdomen proper as well as the pelvis are located. Okay, so for easy studying and understanding, so such kind of regions of the abdominal cavity has been implemented by the anatomists. Okay, and the next region called as perineum. So this I have told that this perineum is the mere lower part. So this is the lower part. Normally that thing we can't see in the standing position or in the coronal position or in sagittal position. So this can be seen only in a separate anatomical position called as lithotomy position. Okay, in that position only we can view this perineum. Okay, so now this is the position of the lithotomy position. Okay, and this is the view of this perineum. Normally this lithotomy position is used to diagnose or used to do some vaginal examinations or rectal operations like that. Okay, here there are two parts. One is the male perineum and the female perineum. Okay, so the perineum is the space between the anus and the scrotum in male. So here this is the anus and in between the scrotum, so this part is called as perineum. Okay, and in between anus and vulva, so this is the anus and the vulva. So here in between this thing, it is called as female perineum. So these are the things can be viewed only in the lithotomy position. Normally these are the secret parts of male and female. Okay, next, this perineum consists of part of urethra. So it consists of parts of urethra, and also external urethral sphincter, and vagina in female, and also the vagina in the female. In males, it also contains bulbourethral glands and the deep transverse muscles. So these are the deep transverse muscles and the bulbourethral glands are present. Okay, so these are the structures present in the perineum in both male and female bodies. Okay, now this is all about the abdomen. So what are the contents of abdomen? So the abdomen is mainly divided into upper part and the lower part, smaller lower part. And this larger upper part, what are the contents present? In the smaller lower part, which is divided into true pelvis and perineum, what are the contents present in the true pelvis and the perineum? Okay, now as I have mentioned that the entire abdomen is bounded by an muscular wall, isn't it? That is, we can call it as abdominal wall. So these are the layers of abdominal wall. These are layers of abdominal wall here. You can see from superficial to deep layers. So superficially, normally this abdomen not only present on the anterior and lateral side, posteriorly this abdomen is also present. So posteriorly the wall is called as posterior abdominal wall, and the anterolateral is combined to called as anterior abdominal walls. Okay, the abdominal wall is made up of some layers called as the first layer. As you people all know that the first layer is the skin. Okay, and the second layer is the superficial fascia, and then comes the muscles. So these muscles are of many layers because of number of muscles. One is the external oblique muscle, internal oblique muscle, and the transversus abdominis muscles. So in between these muscles there is some intervening fascia is also present. Okay, so one is the skin, superficial fascia, and the entire thing is called as muscular layer. Okay, and also a continuous layer of fascia which are named according to the region wise. Like if the fascia is present after that muscular layer, the next layer is the another facial layer. So that facial layer will have the names of region wise. Which is nearer to the diaphragm, that is called diaphragmatic fascia, and which is towards the transversalis muscle, that is fascia transversalis. And if you go below, then it is called as that means pelvis, that iliac bones, the fascia is called as fascia iliaca, and when it enters into the pelvis, then it is called as pelvic fascia. And also the connection between thorax and lumbar, that is called as thoracolumbar fascia. So whenever the fascia is crossing to different regions, according to that regions, the fascia is getting that region name. Okay, so this is the fourth layer. After that muscles, and after that you'll have an what you call as extraperitoneal connective tissue. Extraperitoneal connective tissue. Here they have mentioned that extraperitoneal fat. So that we can call it as extraperitoneal connective tissue. and finally it is having, the final layer is called as peritoneum. What you call as peritoneum, that is the parietal peritoneum. Normal, like pleura, it is also having two layers. One is the visceral layer and the parietal layer. The parietal layer is the outermost layer, so it is comes under the layers of the abdomen. Okay, and after that the cavity present is called as peritoneal cavity, and then the visceral layer. That visceral layer surrounds the organs. Okay, so the peritoneum, which provides a slippery surface for the movements of the abdominal viscera against one another. Okay, so these are the layers of the abdomen. So all these things we are going to study in detail as individual part, like anterior abdominal wall, like that we are going to study. Okay, next one is the, so if you can see, I have already mentioned the cavities, that is the abdominal cavities and the pelvic cavities. The abdominal cavity is much more extensive than what it appears to be when seen from outside. Normally this abdominal cavity projects into the, this abdominal cavity projects into the thorax. Okay, costal margin, deep to the costal margin to reach the diaphragm. So like this. Okay, next, it also projects downwards as the pelvic cavity within the bony pelvis, like this. So these here in this way you can see this. So this is the about the abdominal cavity. Okay, and also this abdominal cavity, some part of the abdominal cavity is also overlapped by the thoracic bony cage above and the bony pelvis below. Now we can see what are the other structures that is called as osteology of the abdomen. In the osteology, what we are going to study is, so if you can see, this is the abdominal part. Yes, this is the abdominal part. Okay, so this is abdomen proper up to here, and then this part is called as lesser pelvis. Okay, and below this one you can have this perineum part. The perineum part will comes the under surface of this pelvis. Okay, so here if you can see what are the bones present in this area. So it includes the lumbar vertebrae and also some parts of lower parts of the thorax, but those things we have already discussed in the thorax region. So now in this abdomen we are going to deal with lumbar vertebrae, so that is from L1 to L5 vertebrae, and then another part is called as the sacrum. So this is a fusion of with 5 sacral bones to form a sacrum here, and then the coccyx here. So the osteology of the lumbar region or abdominal region includes the lumbar vertebrae, sacrum and coccyx, and a pelvis together. A pelvis together, not individual bones. This is two hip bones. That hip bones we are going to study separately in the lower limb, but in the abdomen we are going to study all these things together as pelvis. So the osteology of the abdomen includes the lumbar vertebrae, sacrum and coccyx, and then the pelvis as a whole, both male and female. Okay, so why we have to study abdomen, isn't it? So here the importance of abdomen is having various uses. To a physician, no examination is ever complete until he or she has thoroughly examined and auscultated the abdomen by the stethoscope. Yes, abdomen is also examined with the stethoscope. They are going to auscultate the abdomen also. Okay, so that thing we are going to see in some later sessions. Okay, and in fact, the patient, irrespective of his complaints, is never satisfied without an examination of his or her abdomen. Okay, to an obstetrician and gynecologist. So, for a gynecologist and obstetrician, the importance of the abdomen is compulsory, isn't it? And the surgeon considers the abdomen as an angina. Angina means that is a thing that is very mysterious and difficult to understand, because in a good proportion of his or her cases, the cause of abdominal pain, the nature of an abdominal lump may not be decided in spite of all possible investigations. Okay, so, and also the laparotomy. Laparotomy is the opening up of the abdomen by a surgeon, which may relieve the disease in many uncertain or not discovered cases. But it is not done, not in all of them, in some mysterious cases. Okay, in the course of evolution, adoption of the erect posture by man has necessitated a number of structural modifications in the abdominal wall and pelvis. Okay, and so that structural modifications of this abdominal wall and pelvis we are going to see in the later sessions. Okay, so this is all about the introduction to abdomen. Okay, in the next session we are going to study, or we are going to deal with the osteology of the abdomen. In the osteology, we are going to see the first one, that is lumbar vertebrae. Thank you.